Living well with arrhythmia, strategies for effectively managing your heart rhythm disorder. Understanding arrhythmia. Arrhythmia, pronounced as arrhythmia, signifies an irregular heartbeat, indicating a departure from the usual heart rhythm. Approximately 1.5% of individuals experience arrhythmias, manifesting as sensations like skipped beats, added beats, or a fluttering sensation. Some may feel their heart beating too fast, tachycardia, too slow, bradycardia, or may remain asymptomatic. While arrhythmias can be harmless, they can also pose emergency situations. If you observe unusual heartbeat patterns, seek immediate medical attention to determine the cause. An appropriate course of action. Arrhythmia versus dysrhythmia. The terms arrhythmia and dysrhythmia are often used interchangeably, both denoting an abnormal or irregular heartbeat. They carry the same meaning, emphasizing the irregularity in heart rhythm. Normal heart rate range. A typical resting heart rate falls within the range of 60 to 100 beats per minute for most adults, with some athletes exhibiting rates as low as the 40s. The normal maximum heart rate, occurring during peak activity, is generally calculated as 220 minus one's age in years. A healthy heart rhythm produces a steady looped-up sound or sensation. Irregular rhythms may manifest as fluttering or racing sensations. Symptoms of arrhythmia. Arrhythmias can be asymptomatic, with physicians detecting irregular heartbeats during physical examinations. However, when symptoms occur, they may include 1. Palpitations, feeling of skipped heartbeats or fluttering. 2. Chest pounding. 3. Dizziness or lightheadedness. 4. Fainting. 5. Shortness of breath. 6. Chest pain or tightness. 7. Weakness or fatigue. 8. Anxiety. 9. Blurry vision. 10. Sweating. 11. Rapid or slow heartbeat. Causes of arrhythmia. Even with a healthy heart, arrhythmias may occur due to various factors, including heart disease, imbalance in blood electrolytes, for example, sodium or potassium, heart injury or changes, such as reduced blood flow or stiff heart tissue, healing process post-heart surgery, infection or fever, certain medications, including antidepressants, decongestants, and antihypertensives, electrical signal issues in the heart, strong emotions, stress, or surprise, lifestyle factors like alcohol, tobacco, caffeine, or exercise, medical conditions such as diabetes, high blood pressure, COVID-19 infection, sleep apnea, thyroid issues, anxiety, cardiomyopathy, and hormonal changes. Types of arrhythmias. Arrhythmias are categorized based on their origin and impact on resting heart rate. Ventricular arrhythmias originate in the heart's lower chambers, ventricles, while supraventricular arrhythmias begin in the upper chambers, atria. Classification by resting heart rate effects includes bradycardia, slow heartbeat, fewer than 60 beats per minute, and tachycardia, fast heartbeat, more than 100 beats per minute. Supraventricular arrhythmias. Premature atrial contractions, early extra beats, generally harmless and requiring no treatment. Atrial fibrillation, AFib. Unusual contraction of the heart's upper chambers, leading to rapid beats, potentially exceeding 400 per minute. Atrial flutter. More organized and regular than AFib, often occurring in individuals with heart disease or post-heart surgery. Paroxysmal supraventricular tachycardia, PSVT. Sudden onset of rapid heart rate with irregular rhythm, starting and ending abruptly. Accessory pathway tachycardias. Rapid heart rate caused by an extra pathway between the heart's upper and lower chambers. Ventricular arrhythmias. Premature ventricular contractions, PVCs. Common arrhythmias characterized by skipped heartbeat sensations. Ventricular tachycardia, VTAC. Fast heart rhythm originating in the lower chambers, potentially serious, especially in individuals with heart disease. Ventricular fibrillation, VFib. Emergency situation where the lower chambers quiver, preventing effective blood pumping, requiring immediate CPR and defibrillation. Long QT syndrome. Prolonged contraction and release of the heart's lower chambers, leading to dangerous rhythm issues and potential fatality. Bradyarrhythmias. This type denotes a slow heart rhythm, influenced by electrical system disorders or specific medications. Subtypes include sinus node dysfunction, resulting from issues with the sinus node, the heart's natural pacemaker. Heart block, occurs when electrical impulses from the sinus node to the lower chambers face delays or blocks. Risk factors for arrhythmia. Several factors may elevate the likelihood of experiencing arrhythmias, including age, with increased risk as individuals age. Genetic predisposition, especially if close relatives have a history of arrhythmias or heart disease. Lifestyle choices, such as alcohol, tobacco, and recreational drug use. Medical conditions, including high blood pressure, diabetes, low blood sugar, obesity, sleep apnea, anxiety. Thyroid disorders, lung disease, and autoimmune disorders. Environmental factors, including exposure to air pollution. Pre-existing heart disease or previous heart disease treatments, such as surgeries. Diagnosing arrhythmia. If irregular heartbeats are noted, a physical examination by a healthcare professional is the initial step. Diagnostic tests and equipment play a crucial role in identifying and understanding arrhythmias, including electrocardiogram, EKG or ECG. Records the heart's electrical activity using electrode patches on the chest, arms, and legs. Holter monitor. Portable EKG worn for 1 to 2 days or up to 2 weeks, measuring electrical signals through the heart. Event monitor. Worn for about a month, recording and storing heart electrical activity when activated by the individual. Implantable loop recorder. Placed under the skin, continuously records heart electrical activity and transmits information to the doctor. Stress test. Assesses how much stress the heart can handle, often involving exercise while monitoring EKG, heart rate, and blood pressure. Imaging tests. CT scans or cardiac MRI used to visualize physical signs indicative of arrhythmias, examining heart structure, function, scar tissue, and arteries. Echocardiogram. Ultrasound-based test to assess heart muscle and valves. Cardiac catheterization. Involves inserting a catheter into a blood vessel, guiding it to the heart with X-ray assistance, and injecting dye to visualize heart structures. Electrophysiology study. Records heart electrical activities and pathways, aiding in diagnosing arrhythmia causes and determining appropriate treatment. Head-up tilt table test. Measures heart rate and blood pressure variations when lying down or standing up, assisting in identifying causes of fainting. Patients may be referred to an electrophysiologist, a cardiologist specializing in heart rhythm disorders, for confirmation of an arrhythmia diagnosis. Treating arrhythmia. Treatment strategies for arrhythmias depend on the specific type and severity. Options may include medications. Various drugs, such as adenosine, atropine, beta blockers, calcium channel blockers, digoxin, potassium channel blockers, and sodium channel blockers, aim to regulate heart rhythm. Vagal maneuvers. Techniques influencing the vagus nerve to induce relaxation and control heart rate, including coughing, breath holding, lying down, and applying a cold, wet towel to the face. Electrical cardioversion. Administering an electrical shock to restore regular heart rhythm, often used when medications prove ineffective. Pacemaker. A device sending small electrical impulses to maintain a safe heart rate, comprising a pulse generator. And wires delivering impulses to the heart muscle. Implantable cardioverter defibrillator, ICD. Primarily used for life-threatening ventricular tachycardia and fibrillation. Constantly monitoring heart rhythm and delivering shocks to restore regular rhythm. Biventricular pacemakers and defibrillators, cardiac resynchronization therapy. Devices synchronizing heart contractions in the lower chambers to enhance blood delivery, consisting of wire leads and a pulse generator. Catheter ablation. Procedure involving the insertion of a catheter to deliver electrical energy to disrupt the abnormal rhythm pathway in the heart. Pulmonary vein isolation. Catheter ablation targeting pulmonary veins, using either radiofrequency or cryoablation to create scar tissue and prevent faulty electrical signals. Cardiac surgery. Options like coronary bypass surgery, mitral valve repair or replacement, and the Mays procedure to address structural issues contributing to arrhythmias. Lifestyle and alternative approaches. In addition to medical treatments, lifestyle modifications contribute to heart health and arrhythmia management. Dietary changes. Embrace heart-healthy foods, emphasizing fruits, vegetables, and whole grains while limiting salt and saturated fats. Moderate caffeine intake may be advisable. Regular exercise. Aim for at least 30 minutes of daily physical activity to maintain a healthy weight and reduce heart disease risks. Moderate alcohol consumption. Limit or cease alcohol intake, particularly if it affects blood pressure. Cholesterol and blood pressure control. Adopt habits and medications as prescribed to manage cholesterol levels and blood pressure. Smoking cessation. Quit smoking to eliminate nicotine-induced increases in heart rate and blood pressure. Seek guidance from a healthcare professional for smoking cessation strategies. Stress management. Employ stress relief techniques like yoga, meditation, breathing exercises, and acupuncture to mitigate irregular heart rate risks. Living a heart-healthy lifestyle. Stress management techniques. Stress can significantly impact heart health. Incorporate the following stress reduction techniques into your daily routine. Mindfulness meditation. Practice mindfulness meditation to focus on the present moment, easing mental tension and promoting relaxation. Deep breathing exercises. Engage in deep breathing exercises to reduce stress and calm the nervous system. Try inhaling deeply for a count of 4, holding the breath for 4 counts, and exhaling slowly for another 4 counts. Progressive muscle relaxation, PMR. Learn and practice PMR, a method involving the gradual tensing and relaxing of muscle groups to release physical tension. Nutritional guidelines for heart health. Maintaining a heart-healthy diet is crucial for overall cardiovascular well-being. Consider the following dietary recommendations. Balanced diet. Consume a well-balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats. Strive for variety to ensure you receive essential nutrients. Portion control. Be mindful of portion sizes to avoid overeating. Use smaller plates, and pay attention to hunger and fullness cues. Limit processed foods. Minimize the intake of processed and high-sugar foods, as they can contribute to heart disease risk factors. Hydration tips. Proper hydration is vital for cardiovascular health. Follow these hydration tips. Adequate water intake. Ensure you drink an adequate amount of water daily. Individual needs may vary, but a general guideline is to aim for 8 8-ounce glasses per day. Limit sugary beverages. Reduce the consumption of sugary drinks, opting for water, herbal teas, or infused water with fruits for added flavor. Monitor electrolytes. Maintain a balance of electrolytes by including foods rich in potassium, such as bananas and oranges, in your diet. Regular cardiovascular exercise. Exercise is a cornerstone of heart health. Follow these guidelines for incorporating regular cardiovascular exercise. Aerobic training. Engage in aerobic exercises such as brisk walking, jogging, swimming, or cycling for at least 150 minutes per week, as recommended by health professionals. Resistance training. Include resistance training, such as weightlifting or bodyweight exercises. At least 2 days a week to strengthen muscles and improve overall fitness. Incorporate physical activity. Find opportunities to be active throughout the day. Take the stairs, go for short walks, or participate in activities you enjoy to make exercise a consistent part of your routine. Complications of arrhythmias. Untreated arrhythmias may lead to severe complications, including Alzheimer's disease and dementia. Insufficient blood supply to the brain over time may contribute to cognitive disorders. Heart failure. Repeated arrhythmias can compromise the heart's pumping efficiency. Stroke. Blood clot formation in the atria, traveling to the brain, poses stroke risks. Cardiac arrest. Ventricular fibrillation may cause the heart to stop, necessitating immediate intervention with CPR. Safe driving considerations. Individuals with arrhythmias face potential risks while driving, as fainting episodes could occur. Evaluation of driving safety involves considerations such as 1. Type and severity of the arrhythmia. 2. Treatment received. 3. Frequency and severity of symptoms. If arrhythmia symptoms are absent, and there are no significant heart rhythm issues, driving may be safe. However, certain treatments like ablation or implantable cardioverter defibrillator, ICD, implantation may temporarily restrict driving. Arrhythmia prevention. While complete prevention of arrhythmias may not be possible, regular medical checkups and communication with healthcare providers contribute to identifying and managing heart rhythm issues. Lifestyle adjustments, including a heart-healthy diet, exercise, smoking cessation, stress management, and moderation in alcohol and caffeine consumption, can complement medical interventions. Medication management. Understanding medications. Individuals with arrhythmias often require medications to manage their condition. It's crucial to have a clear understanding of these medications. Antiarrhythmic medications. Learn about commonly prescribed antiarrhythmic drugs, such as amiodarone, flecainide, and propafenone. Understand how these medications work to regulate heart rhythm. Beta blockers. Explore the role of beta blockers, like metoprolol and propranolol, in slowing the heart rate and reducing the force of contractions. Understand the benefits and potential side effects. Calcium channel blockers. Gain insight into calcium channel blockers, including verapamil and diltiazem, and how they influence the electrical activity of the heart. Understand their role in managing arrhythmias. Anticoagulants. Understand the purpose of anticoagulant medications, such as warfarin or newer agents like apixaban and rivaroxaban, in preventing blood clots associated with certain arrhythmias. Digitalis preparations. Learn about digitalis medications, like digoxin, and their role in controlling heart rate in specific arrhythmias. Potential side effects. Be aware of potential side effects associated with each medication, including interactions with other drugs or substances. Importance of adherence. Emphasize the importance of adherence to prescribed medications. Discuss strategies to remember doses. And the significance of not altering medication regimens without consulting healthcare providers. Medication interactions. Understanding potential interactions between arrhythmia medications and other drugs is essential for overall health. Communication with healthcare providers. Stress the importance of open communication with healthcare providers about all medications being taken, including over-the-counter drugs, supplements, and herbal remedies. Common drug interactions. Provide information on common drug interactions that individuals with arrhythmias should be aware of, such as interactions with certain antibiotics, antifungals, and medications for other health conditions. Pharmacy consultations. Encourage individuals to consult with pharmacists when filling prescriptions, ensuring they are aware of potential interactions and can provide guidance on safe medication use. Regular medication reviews. Advise individuals to undergo regular medication reviews with their healthcare providers to assess the continued appropriateness of the prescribed medications and adjust the treatment plan if necessary. Emergency situations. In case of emergencies or new health issues, stress the importance of informing healthcare providers about existing arrhythmia medications to prevent potential adverse reactions. In conclusion, vigilance regarding irregular heartbeats and other arrhythmia symptoms is crucial. Prompt consultation with a healthcare professional allows for accurate diagnosis and tailored treatment plans. Arrhythmias vary in severity, and understanding the specific type informs appropriate interventions, ensuring optimal heart health and overall well-being. Your health matters. Quali.health